Okay, this is Paige Toth. I'd like to call the meeting to order. It is 5:33. Can we get roll call, please?
Paige, I'm sorry. Can I interject really quickly?
Yeah.
I did want to I forgot to remind everyone, we are live streaming this and we are also recording it. So by being on the meeting, you are giving your consent to be recorded. So I apologize. I forgot to state that.
Yep. Okay, roll call, please.
Paige Toth.
Here.
Candace Clevenger. Vivian Goodman.
Here.
Jan Hack.
Here.
Dr. Jerger. Sue Crows.
Here.
Mary Jane Linton.
Here.
Dr. Meningati. Dr. Patterson. Phil Tibbs.
Here.
And Laura Zimmerman.
Here.
Okay, we all have a copy of the agenda. Are there any changes to the agenda?
No, there are not.
Okay, can we get a motion to approve?
Motion to approve, Vivian.
I'll second.
Okay, all in favor?
We do have to do a roll call with that one because of the nature of the meetings right now and COVID-19.
Yep.
Paige Toth.
Yes. Approved.
Candace Clevenger. Vivian Goodman.
Yes.
Jan Hack.
Yes.
Dr. Jerger. Sue Crows.
Approved.
Mary Jane Linton.
Here. Yes.
Dr. Patterson. Phil Tibbs.
Yes.
And Laura Zimmerman.
Yes.
Thank you. Do we have any public comments?
We did not receive anything for public comment. And I did just want to say, Dr. Jerger, I'm not sure if you were speaking when you unmuted, but we haven't been able to hear you. So I did want to let you know because per the record, Dr. Jerger is on the line, just so everyone knows. But no, we do not have public comment. Thank you.
Is that better now?
Yes.
Okay, great.
Okay, the meeting minutes from last month are in your packet. Can I get a motion to approve?
Laura, so moved.
In a second?
Jan second.
And roll call vote, please.
Paige Toth.
Yes.
Vivian Goodman.
Yes.
Jan Hack.
Yes.
Dr. Jerger.
Yes.
Sue Crows.
Yes.
Mary Jane Linton.
Yes.
Phil Tibbs.
Yes.
And Laura Zimmerman.
Yes.
Thank you, Brandy. Do we have communication from you, I assume? A little bit?
Just a little bit, yes. So the first thing that I would like to touch on, of course, is just the COVID-19 update as usual. You probably have seen our daily releases that go out each day and the updates with those. We will also be putting some more information out in the next day or so that would be more specific to the numbers that we are seeing right now. If you've been paying close attention, we have seen a decline in not only our daily case number, but also the positivity rate. If you remember when we spoke last, I think we were in the 18 point something %, and as of this morning, we were at 6.6. So there's been a significant decline decline. And some other areas are seeing this as well. And of course, that could be for a lot of different reasons. We do still have those hospitalizations, of course, and we all want to be mindful of that and ensuring that we are not burdening the healthcare system. So we're going to put out a little bit of information about that just to let the public know that, yes, this can definitely be a hopeful sign that we are, following the mitigation measures and we are taking those preventative measures. And maybe people chose not to gather outside of their household for, the Thanksgiving holiday, but that we all need to, remain steady with this and continue to do it, especially with the ongoing and upcoming holidays. So we'll put something out with that. But we just thought it was important if we put something out more than just a daily release, if numbers aren't looking good, that we should also want to make sure to reflect when some of the indicators are looking a little better as well. Another thing that we'll be addressing in that communication would be vaccine. You probably all have seen that we were in that first 50 to receive the first shipment of vaccine from Pfizer because of the death rate that we had here. So of course, we don't want that death rate, and we have lost a lot of very important people here in our community. However, because of that, we were, chosen within that group to receive shipment during the first week. So we will be receiving vaccine here this week. We have been planning for this. I have to say, even before the pandemic, one of the things that we planned for and write memorandums of understanding for and do practice drills for is mass vaccination clinics. So fortunately, this is something we've talked about for years and years, and the possibility of something like this happening and making sure we were prepared. Of course, this has been very different and on a much larger scale than any of us would have thought we'd probably experience in our public health careers or healthcare careers in general. But we're doing it this week. We've been planning for it. We've been in communication with our healthcare system, law enforcement, et cetera, to ensure that we are prepared and ready to go. And so I do feel very confident in our team here at the health department, everything that they have done to ensure our plan is not only updated, but also reflective of what IDPH is requiring. Also to make sure that we are as informed as possible, whether it's from the emergency preparedness side or the communication side, and then even, the nurses that are going to be actually administering this vaccine. You can't even really begin to imagine how many calls and webinars there can be with this, but our team has made sure to be on all of them, and I'm very grateful for them and proud of everything that they've done, and we're ready to go. So I think with anything we can't expect perfection, and I think that that's the same whether it's the health department or any healthcare entity or anyone in life really, but I feel as if we're ready to go, very prepared, and if there are any glitches or bumps in the road, that we will be able to quickly pivot as we have throughout this entire pandemic here at the health department and make sure that we're doing things the right way and the best way as we move forward. There are several phases if you have not seen that information put out. So we will be following the ACIP guidelines as far as whom is vaccinated and in what phase as we work through that. So that might be something that causes a little confusion in the general public that you could help us advocate about, that we will follow that, and that's when we will decide whom gets vaccinated. It will take several months to get everyone vaccinated, and then of course, as you've seen, there's actually the 2 shots separated by 21 or 28 days. So it is important that people also know that they still should be social distancing and masking, taking those preventative measures even after people begin to get vaccinated. It does take a while, of course, for the effectiveness to be there and for everyone to be vaccinated. So very important that people, again, remain dedicated to following that public health guidance, even as we start to implement vaccine. I think that in a time of this pandemic where there's been definitely some rays of light and a lot of slivers of joy in a very tragic and difficult time, this is a major point of time where we can see hope and kind of see that light at the end of a very long and twisted and difficult tunnel. So I think that every day is difficult in a pandemic, but I think this week is definitely a time of hope for us to be able to look into the future at protecting the lives here in Macon County and throughout our world. Another piece of, COVID update would be in communications. We are doing some advertising, which would be specific to masking, social distancing, and then also vaccine education and promotion. So one of the things that we are doing is asking partners, community leaders, staff, board members, if any of you are interested in doing a short video with us that then we would share out with the community to talk about why you are choosing to be vaccinated. If you are, we do feel as if people share their personal stories and why they are choosing to be vaccinated, or even if it's, I choose to mask because, or I choose to social distance because, that will help people see the personal side of this pandemic and help make those choices to protect the lives of others. So if anyone is willing to do that, please reach out to either me or to Marissa, our Director of Health Promotion, and let us know, and we will definitely get you signed up. We will do that virtually so that there will be no extra risk of exposure, so you don't have to worry about having to come and be in contact with anyone. We'll keep you and ourselves safe while we do that, but still ensure that we're getting that communication out. And then enforcement, we've talked a lot about enforcement in the time of COVID with mitigation measures. Last month, we received direction from you to go ahead and follow steps in addition to the process we had already been following for months, then to also, if and when necessary, suspend food permits if there was that risk presented that we felt was appropriate to follow that step. We have issued several cease and desist orders. That has been what has, I think, been the deciding factor for many food establishments to get compliant when they have not been for a significant amount of time, which was our hope, because of course we did not want to have to close anyone down. We want, as we have said before, to educate and partner and make things safe and save some lives. And so we did end up having to suspend one food permit because after a cease and desist order, there was still no compliance there, and there was definitely risk presented. So the closure, as we had stated, even if someone was closed, there were steps in place to where they could apply to get opened back up and submit a corrective action plan. And that was done. The place got compliant, opened back up, and was taken care of. So I know that there was some dislike of that process that we followed. But I think in a situation like this, like we talked about, our priority has to be the public health and saving lives and doing everything as appropriate that we can do to protect the people in our community or the people visiting our community. So we did feel like due diligence wise, and I know that as a board you supported us in that we could or should follow those measures when appropriate. I will say also, just to make you aware, that at the last county board meeting, there was public comment specific to this, stating that someone felt as if we overstepped what was appropriate for us to be doing. And so if you do get any calls or anything, I have not gotten any follow-up from that, but I did want you all to know that that did occur. So if you hear anything and you have any questions for me, obviously you can always get a hold of me. You can also send someone to speak with me if they reach out to you directly. I'm happy to have those conversations. And I do appreciate, Dr. Zimmerman, I know that you kind of spoke to the board and how we came to that decision. I was very grateful for that. So thank you, because what Dr. Zimmerman reflected was that that was a difficult decision and we all took that very seriously, but that what we are trying to do is save lives. So thank you for that. Thank you very much. And so that is most of what I have for COVID, to keep it kind of high level. I just, I know that I always try to reflect on what the staff here are doing, and it's hard to really portray that in a brief summary for all of you, but they continue to be flexible. When Tier 3 mitigations were implemented, we sent even more people into a remote work environment, even though they had been separated. We had some cases associated with the health department, and so we did everything that we could to try to keep all of our staff, clients, and patients safe. And whether it was the team that was actually being sent home, or if it was the supervisors who had to coordinate that or help cover positions here physically in the building, or if it was administration and IT figuring out even more logistics that we needed, everyone has just been beyond extraordinary. I'm very grateful for them. And the fact that they still come in this building or meet with us on Teams or show up with such a good attitude after dealing with this for so many months, and also experiencing some of the negativity and attacks that they have out in public, over the phone, and on social media. I just could not be more grateful and proud of the team that we have here. They've always amazed me, and I've been proud to be able to be on a team with them, but they just keep going. And some days I think it's hard to know how they do or why, but I think it's very clear that they are in this role because they're passionate and they care about people. And that could not be more exemplified than it is right now. So a very public thank you to my team, and also a thank you to the board for being supportive of us and everything that we are trying to do and helping guide us when we've been confronted with some extremely difficult situations. And thank you for advocating for us when I know sometimes we are not getting the best reputation sometimes in the public when we're having to deal with some difficult things like this. And unfortunately, with the pandemic being so politicized in some ways and so much negativity surrounding it, I think our staff continues to show up and our board has continued to show up in a positive way. And I'm just very thankful. So thank you. And that's all I have for that. If anybody has COVID specific questions, I'm happy to answer those. And then I was just going to briefly cover the Board of Health and Administrator authority document if there are no COVID questions. Okay, so not seeing any COVID questions, I will go ahead and go over the, the Board of Health and Public Health Administrator Authority form. And I'm going to share my screen. Hang on one second. And I know that you all have it there in the meeting, but since we are live streaming, I thought I would just bring this up and just kind of be able to give a visual to it for the community. This is a form that we do go over, and if you were on our board last year, this is something that we have on our Board of Health education calendar to do every year in December. So you can see this just reflects what the authority that administrator has, and then of course what authority would be on behalf of the Board of Health. So you all have received this, and of course it's important that we all know and understand that, especially if there are any questions that come up or if there's anything that you feel like I need to do differently. So that being said, if anybody has any questions about that Board of Health and Administrator Authority, I'm open to those right now. Or if you want me to go over something in a lot more detail, I can, but I know we've all seen that more than once. It has not changed from last year. If you were on the board and if you were wondering, we did not make any edits to that. And if there are no questions about either of those things, Paige, that's all I have for communication.
Great, thank you, Brandy. Does anybody have any questions? Okay, I think we are ready for the financial reports.
Hello. Okay, the financial report is in your packet, and this is through the end of November, so we were 100% into the fiscal year. November 30th is our year end. So accounts receivable was at $726,000, deferred revenue at $303,000, and our ending fund balance at $5.2 million. Total revenue at $6.8 million, which is 79.4% into our budgeted revenue, and total expenditures at $6.4 million, which is 75% into budgeted expenditures. I will also tell you that this isn't 100% complete at this point. We still have some invoices for 11/30 rolling in and some year-end adjustments that still have to be completed. So once that is all finalized, I will come back with a final report as of 11/30. Are there any questions?
No, I don't think so. So without the final report, do you still want us to vote and approve the financials as presented?
Yeah, I think so, probably.
Okay. All right, can I get a motion to approve?
Brett, approve.
Andy, second.
Second. Okay, thank you. And roll call vote, please.
Paige Toth,
Approve.
Candace Clevenger,
Approved.
Vivian Goodman,
Approved.
Jan Hack,
Approved.
Dr. Jerger,
Yes.
Sue Crows,
Approved.
Mary Jane Linton,
Approved.
Phil Tibbs,
Approved.
and Laura Zimmerman.
Approve.
Thank you. The department expenditures are in your packets. Can I get a motion to pay the bills, please?
I so move.
And a second?
Second.
And roll call vote, please.
Paige Toth,
Approve.
Candace Clevenger,
Aye.
Vivian Goodman,
Yes.
Jan Heck,
Yes.
Dr. Jurger,
Yes.
Sue Crows,
Yes.
Mary Jane Linton,
Yes.
Phil Tibbs,
Yes.
and Laura Zimmerman.
Yes.
Thank you. Brandy, do we have any grant applications for review? Okay. Your division reports are in your packet. Do we have any questions on those?
I do want to say, I hope that you're all able to take time to review those department or division reports. Obviously, as you can see, there's a lot of other things going on here at the health department in addition to just COVID. So I know that I do give communication every month within that topic, just because I think it's important to touch on that since it is such a major thing we're dealing with. But our staff and leadership team are certainly handling a lot of other things, and we have continued services in some adapted or the same format as pre-pandemic. Almost completely. We do not have the STI clinic back open yet just because we have not had enough nurses, but with the number of contact tracers that we have had or been able to hire and our transition and leadership, down in nursing and being able to hire more nurses who have started or will be starting in the very near future, we're even hoping to get that back going. So to be able to still provide all of the essential services in our community and handle a pandemic and nearly double the size of our workforce, I think has been pretty amazing, and obviously takes a very strong team to be able to handle all of that. So I hope that you're able to review those and see all of the amazing work that the teams are doing in addition to handling COVID and being ready to respond in any way that they are required pretty much any given day. That's all I have. And the supervisors are on the meeting if you have questions for them specifically.
Thank you, Brandy. Does anybody have any questions?
No.
Okay, well, thank you everybody for all your hard work. I read through them, and there's a lot going on outside of COVID, even though it definitely feels like COVID is taking over everything right now. Moving on to December anniversaries and employee recognition. Marissa is on the call, I believe. Thank you so much for 6 years of service. I'm so used to seeing your emails come out every day, so I feel like I'm in contact with you constantly. And Pamela Day has been here for 2 years, and Tiffany Rickman for 2 years. So thank you to everybody for your December anniversaries and your work. Old business. We have enforcement of COVID-19 public health guidance. Do you have anything to add on that, Brandy?
There's not really anything in more detail that I would like to add. I did want to make sure to have this on here just in case there was, any specific questions or anything that had happened between when we put this out last week. And then, of course, if anything else significant happened in between there, our team does continue to accept many complaints and follow up on those. Again, a lot of establishments have gotten compliant either when we have called them or when we have gone out there. So we're thankful for that because that's the goal. And so hopefully we will not have to do any other suspensions of food permits, but if and when that becomes necessary, we will. We do have some limitations to safety and security and going out on those. So we have been trying to figure out having, basically a security person with us, just because, yes, normally serving a cease and desist order may not get dangerous. But as you all have probably seen in the media, throughout our country, there have been some, tragic things that have happened to people that work at a grocery store, let alone a health department employee going out and trying to enforce some of this. So if there is a situation when we feel as if we need someone with us, we are aiming to have an officer with us. Unfortunately, we don't have that every time. And so I will tell you, to be completely upfront, if there are situations that are too dangerous for our health department staff to go and we are unable to obtain law enforcement to go with us, that may be a situation that we would just have to update you on. But obviously our staff and their safety are of utmost importance to us, and making sure that they are okay, because they deserve to make it through this safe and healthy too. And so I'll keep you updated if we see, any more complication with that. But I do just want to be upfront with you that we don't always have the law enforcement on a proactive way that we wish we did, as far as being able to have someone every single time. And if that becomes an issue, I will let you know. Right now, we're working through it, but there are only so many options as well. So if anybody has any questions, I'm happy to answer those. But I did just want to kind of give you a heads up that if it moves that direction, things could change pretty drastically, pretty quickly, and I will communicate that with you for sure if it does. And that's all I have for that. You're muted, Paige, if you're
Oh,
talking.
sorry, the update on the Gabby's hearing.
So I know that we talked at the last meeting and this was expected, but I just wanted to bring you an update with it that we did rescind the revocation because we were unable to obtain a quorum to have that hearing. So of course we did have a plan in place with them in order to ensure that they are compliant, safe, et cetera. But I wanted to let you know that that is what we ended up having to do with that situation.
Okay, and follow up on election of officers.
Well, this might be obvious, but I know you all know what happened at the last meeting, but we left this off as if Paige accepted, then all positions would be filled. And as you see, Paige accepted. Thank you so much. And so all of those are filled, and we obviously have, you know, a new president in that spot. So that was all I had for that.
Okay, new business, recruitment of Board of Health members.
So we do have I think it's 3, I could look at my list, but off the top of my head, I think 3 people whose terms are ending in May of 2021. I do not want to wait until May to have people to fill those positions or to know if board members would accept staying on and to be presented to the county board as someone that would continue. So if your term is ending in May of 2021, and if you're not sure, we can even communicate with you via email just to let you know if you're one of those people. Please think about if you would like to plan to stay on, and if so, we can go ahead and start the paperwork now. And then also I am pretty sure that Candy doesn't plan to stay on, and her term ends in 2021. So we definitely need someone to fill that position. And generally the board assists with recruiting people, you know, finding a group of people that may be interested and kind of keeping a list. The last times that we have looked and that I've been involved, we were looking for more, you know, people in nursing and healthcare field. And so a couple of the things of many that I think Candy has brought specifically are definitely her fiscal background and then her knowledge of mental health services and behavioral health. And that is one of the things that is in the act that is desired, not required, but desired to have on your board is someone with that mental health service experience. So I do think that we need to aim to find someone that could fill one or both of those in replacing Candy if in fact she does not plan to continue. And then if any of the other people do not plan to continue, the sooner I know that, the better. And then hopefully we can, you know, work together. The board can handle it if you want. I don't mean to take anything away from anyone, but I'm happy to assist if I can. I just want to make sure we do that as soon as possible so that we don't have a gap on our board.
Okay. Appointments to committees.
Okay, so in December of every year, we do appointments to committees. So I will tell you whom is on each committee. And then if everyone that's on a committee chooses to stay, then that's fine. And we would just vote to appoint for a new term. However, I know that for nominating committee, we do need a replacement for Paige. Paige have volunteered, I think, just a few months ago. And because Paige is the president now, she cannot be on the nominating committee. So I know that we do need someone to fill that spot. So what I have is Finance Committee. We currently have Candy, Vivian, and Mary Jane. And I will say, for example, with Candy being on finance, the bylaws do provide that, of course, if Candy's term ends in 2021, she could still serve in this position until then, and then we could just appoint someone new for the following month to fill that position until the new appointments next December. Does that make sense? Okay, so Personnel Committee is Candy, Vivian, Mary Jane, and Paige. And then, like I said, Nominating Committee does have Paige, and then Jan and Laura, and that does need to be 3 people per the bylaw, so I will need someone appointed to replace Paige on that committee. And then the Bylaws Committee is Dr. Miniganti, Paige, and Laura. So I guess what I need to know is if everyone is willing to stay in their spots, we can do those appointments, and then we need a replacement for Paige on the Nominating Committee.
I'm fine with staying on the committees that I'm on now.
I am as well.
I am too. That's Candy. I am too.
Thank you.
I'm fine with mine.
Okay.
I don't know when my term is up, but I don't think it's this year. And I'll stay on. I mean, if I
Okay.
don't know, is it routine to stay on, or do you have to be kicked off and be renominated, or I don't know.
No, you can stay on. We do have to submit that paperwork. If you remember from when you first came
Yeah,
on, there was
right.
a document. We would have to resubmit that to the county board chairman, and then that would be submitted to the full county board. So of
Mhm.
course, we make the board makes their recommendation and votes on someone that then gets sent to the county board chairman, who then basically decides whether or not that person would be presented to the county board. And hopefully if our, as a board, our recommendation is sent to the county board chairman, it would then be presented in front of the county board for a vote. So hopefully, especially if you've served on the board and, of course, have been very active and are willing to continue on, we would hope that you would, and of course, that you get voted through. And the sooner we have that paperwork through, the better.
Okay. I didn't know if it was best to have new people each time. If it is, I'm not offended by that either, but it is enjoyable. I'm happy to do it.
We are happy you are here.
Thank you.
All right, and I think Dr. Miniganti was on, so I'm not sure if you're there, Dr. Miniganti, if you're willing to stay on the bylaws committee.
Hi,
If
Brandy.
not-
Hi, Paige.
Hi,
Hi, can you hear me?
I can.
Yeah. Hi, everybody. Yeah, I'll stay on as a member of the health board. Bylaws committee is fine too. So
Okay. So the only thing we need then, Paige, is someone to be appointed to the nominating committee in your place.
Any takers?
It's really not too bad to be on that committee. There's not a whole lot, just
No.
a couple of small things.
Well, and I can tell you, I have it pulled up here. So the responsibilities for the nominating committee would be performing the annual participation review, and that would be basically evaluating presence or absenteeism of board members. Advise the board regarding filling of officer vacancies. So if you remember, just a couple months ago, the nominating committee presented a slate of officers to be voted on for the upcoming year. And then recommend persons to fill board vacancies. So that would be what I'm asking everyone to help with, which is just recommending someone for a board member spot that is open. And then present, this is kind of the same as number 2. So present a slate of officers. So it not only is saying present that slate of officers annually, but also if there's a vacancy, let's say in the middle of the year because a term ends, then you would suggest someone to fill that officer vacancy then as well.
okay, Brandy, I'll take it.
Okay, thank you, Dr. Miniganti. So Paige, if you accept that, then we can do a vote to appoint everyone in these committees.
Yes, I accept that. So do we need a motion for all the appointment of the entire slate of committees?
Okay, that's fine.
Okay, can I get a motion?
Brett, I'll make the motion.
And a second?
Phil, I'll second.
Okay, all in favor, roll call?
Paige Toth,
Approve?
Candace Clevenger,
Yes.
Vivian Goodman,
Yes.
Jan Hack,
Yes.
Dr. Jerger,
Yes.
Sue Crows,
Yes.
Mary Jane Linton,
Yes.
Dr. Miniganti,
Yes.
Phil Tibbs,
Yes.
and Laura Zimmerman.
Yes.
Great, thank you. It looks like we're ready to move into closed session. Do we make a motion to go into closed session?
Yeah, and we'll have to roll call that one too, yes.
Okay.
Please.
Motion to go into closed session.
Phil, so moved.
Laura, second.
Okay, can we get a roll call?
Paige Toth,
Approve?
Candace Clevenger,
Approve.
Vivian Goodman,
Yes.
Jen Hack,
Yes.
Dr. Jerger,
Yes.
Sue Crows,
Yes.
Mary Jane Linton,
Yes.
Dr. Meningati,
Yes.
Phil Tibbs,
Yes.
and Laura Zimmerman.
Yes.
Okay. Motion passes. Brandy, I don't know what kind of technical voodoo we need to do to get into closed session, if any. But
We
Brandy,
actually have a
this is-
nice list here.
okay.
Brandy, this is Kathy. May I say something really quick before you guys go into closed session?
Yes.
So I know I speak for all of the other advisors and directors that are sitting here on this call, and we just wanted to make sure that you as the Board of Health knew how strong of leaders that we have in Brandy and Bethany through all of this. They have continued to be strong, influential women who have pushed all of their team to continue to strive to do the best, and we are all taking a cue from them, and we wanted to make sure that that they know that they are recognized as well as much as what they recognize us. So we thank you both for being so strong and influential and always holding us up when we're about ready to fall down.
Right back at you. Thank you so much. That's very nice of you. And yeah, Bethany does an amazing job. She definitely, like the other directors, has helped keep me going through this, that's for sure. So thank you very much, leadership team. Appreciate you very much. All right, so at this time, with going into closed, everyone will leave the meeting except for board members. You have to stay, get to stay. Bethany will remain in the room. Sandy, our administrative assistant, will remain in the room. I'm going to turn off the recording now. And Evan is going to text me once he can confirm that the live.
Okay, can I get a roll call for us to come back into open session, please?
Paige Toth,
Here?
Candace Clevenger,
Here.
Vivian Goodman,
Here.
Jan Hack,
Here.
Dr. Jerger,
Here.
Sue Crows,
Here.
Mary Jane Linton,
Here.
Dr. Meningati,
Yes.
Phil Tips,
Here.
and Laura Zimmerman.
Here.
Great. Brady, do you know if we have to vote on each of those closed minutes individually, or since we voted to keep them all closed, can we do them in a group?
You can do them as a group.
Okay, so in closed session, we reviewed several sets of closed minutes, and can I get a motion to keep all of those closed due to the personnel issues and litigation matters involved?
I so moved.
So moved.
Do we get a second?
Second.
Jan, second.
Second.
Okay, roll call vote, please.
Paige Toth,
Approve.
Candace Clevenger,
Approved.
Vivian Goodman,
Approved.
Jan Hack,
Yes.
Dr. Jerger,
Approved.
Sue Crows,
Approved.
Mary Jane Linton,
Approved.
Dr. Meningati,
Yeah.
Phil Tips,
Yes. And can we
and Laura
clarify?
Zimmerman.
I'm sorry. Can we clarify with Sue? I believe it's Sue Kraus and not Sue Crows that we keep saying.
Oh, okay.
Thank you,
Sorry.
Phil.
I heard that and I thought, oh, I've been saying it wrong. I hate
okay.
mispronouncing people's names. I'm so sorry.
That's okay. I'll answer to anything.
We'll get it right for you.
Thank you.
Sorry, Sue.
No problem.
Laura Zimmerman.
Approve.
Thank you.
Thank you. Okay, I think that's all the action we have for today. So does anybody have a motion to adjourn?
Laura, so moved. And good job on your first meeting, Paige.
Oh, hey, thanks. I'll get through it. Well, thank you, everybody.
I think we'll do a roll call on that just to be safe
Okay.
too. I know we've done it, 20 or so times, but just to be safe that we're covered.
Paige Toth,
Have a nice
I approve.
Candace Clevenger,
Yes.
Vivian Goodman,
Yes.
Jan Hack,
Yes.
Dr. Jerger,
Yes.
Sue Crows,
Yes.
Mary Jane Linton,
Yes.
Dr. Meningati,
Yes.
Phil Tips,
Yes.
and Laura Zimmerman.
Yes.
Okay, well, everybody have a Merry Christmas.